right, Dr. Jill Jennings is here from St. Vincent to answer your questions, particularly about cervical cancer, because one of the things we really want to make sure people know is that it is preventable if you get treatment at the appropriate time, right?
Right, and screening with pap smears, and if people follow the routine screening and things like that, we should be completely preventing cervical cancer.
Okay, and tell me the numbers very quickly before we get to our callers in terms of mortality rates.
So it really doesn't have that high of a mortality rate in developed countries like the United States, where people have access to getting pap smears. We only see about 4,000 deaths a year from cervical cancer, but that number really should be zero because it's a completely preventable disease.
Sure.
So,
well, thank you for sharing that information, Dr. Jill, if you don't mind me calling you that. We're going to go ahead and get to our first caller. It's Misty from Jonesboro. Good morning, Misty. You there?
Hi, yes, I'm here.
Okay, go ahead with your question.
I'm 30 years old, and I don't know, am I too old to get a cervical cancer vaccination, or like what age should I get it? And will it prevent me from getting it and getting cervical cancer?
That's a good question, Misty, because we've heard a lot about getting those vaccinations earlier and earlier for young people. How about it for her age?
right, so really the FDA has approved that vaccination up to age 26, starting at age 9 and up to age 26. The Center for Disease Control recommends that girls between 12 and 13 get that vaccination. The goal is really before you're sexually active, and this is a vaccination against the human papillomavirus, which we know is the cause of most cervical cancers. And so the goal is to get that before you're sexually active, because once you're sexually active, you have up to 85% chance that you're gonna have HPV. Most people clear it. This is a vaccine against the people who will not clear this virus, and it will go on to cause cervical cancer. But to answer your specific question, you're never too old. It's just not FDA approved for you, but it doesn't mean that you're absolutely too old to get it. You know, if you're someone who's not in a stable relationship, you know, you've recently gotten a divorce, or you think that you're going to have multiple other sexual partners in your life, then it would be a good idea to get it.
Okay, well, thank you. And thank you, Misty. Let's check in with Cynthia now from Little Rock. Good morning, Cynthia. How are you today? Cynthia?
Good morning.
Okay, go ahead.
My doctor, I'm 55 years old, and I'm postmenopausal, and my doctor retired. My girlfriend tells me that I should go to someone who is a gynecologist only. Do you accept older postmenopausal patients?
Are you asking Dr. Jill specifically if she does?
Yes,
Okay.
and because is there a long time wait in the waiting room because of pregnant patients?
Okay. Dr. Jill is she's newly in practice, so how are you standing now in terms of new patients?
Right, I just started practice in September. I joined an established practice, Dr. Bill Harrison, here in Little Rock, so I'm building my practice completely from scratch. I am happy to have all new OB and GYN patients. Right now, I don't have a long wait in the waiting room. You can't say from day to day what's going to happen, but I would love to have any and all new patients. Okay,
well, go ahead and make your appointment now. Thanks. All right, Carol from Little Rock. Good morning, Carol.
Good morning.
Go ahead with your question.
I have a 16-year-old daughter, and when do I need to start taking her to the gynecologist?
Okay, that's another good question. What's the appropriate age to take a teenager to the gynecologist?
I think, you know, as soon as they start having questions that would be appropriate for a gynecologist to answer, if they are becoming sexually active, if they have questions about birth control, if they have questions about this new HPV vaccine that we're talking about for prevention of cervical cancer, those are all great reasons to bring, you know, your daughter to the gynecologist. As far as specifically when you need a pap smear, the recommendations have sort of changed over the years. It used to be 18, then it went from, you know, 3 years after you're sexually active. Now they're saying 21. But I think if people are sexually active earlier and earlier, it's not necessarily against the rules to do it before that. So it's just kind of a person-to-person thing, and I think that there's never an absolutely too young. As soon as people have questions or feel that they need to to see a gynecologist, that is just fine.
I guess a lot of people would have a question as to whether or not they need to make the shift from pediatrician to a gynecologist. So.
Yeah, and I think the normal age is probably around 17 or 18 for that. But a lot of times these younger girls that are, when they start their periods, they're having lots of questions about that sort of thing, and may need some help with that. So,
well, all great questions, and thank you so much for answering them. We want to remind you again, Dr. Jill says she is taking new patients, so if you need to see her, there's her information on the screen. She's at 500 South University Suite 815. You see the phone number there, 664-9232. Thanks once again.
Thank you.
Good luck with your practice.
Oh, thank you.
And happy holidays to you.
All right, you too.
We'll see you next time.
All right.